to the various medical procedures that involve the repairing the structural problems in the brain. There are numerous types of brain surgery. The type used is based on the area of the brain and the condition being treated. Advances in medical technology have enabled the surgeon to operate on the portions of brain without a single incision in or near the head. Brain surgery, this is a critical and a complicated process. The type of the brain surgery done depends highly on the condition being treated. For example, the brain aneurysm can be repaired using the catheter that is introduced into the artery in the brain. If the aneurysm is structured, an open surgery called craniotomy may be used. Surgeons, by being as careful and thorough as possible, take each surgery on a case-by-case basis. So here we can look why brain surgery is done. Brain surgery is done to correct the physical abnormalities in the brain. This can be due to the birth defect, disease, injury, or the other problems. You may need the brain surgery if you have any of the following conditions in or around the brain: abdominal blood vessel and aneurysm, bleeding, blood clot, damage to the protective tissue called the urometer, and the epilepsy. Here we can look what are all the types of brain surgery. There are several different types of the brain surgery. The type used depends on the problem being treated. Craniotomy involves making an incision in the scalp and creating a hole known as the bone plate in the skull. The hole and the incision are made near the area of the brain being treated. During the open brain surgery, your surgeon may have the option to remove the tumors. They may also have the clip off an aneurysm, and they use to drain the blood or the fluid from an infection and remove the abnormal brain tissue. When the procedure is complete, the bone clot is usually secured in the case with plates, sutures, and all the wires. The hole may be left open in case of tumor, an infection, or the brain swelling. When left open, the procedure is known as craniotomy. Biopsy. This is a procedure that used to remove a small amount of a brain tissue or a tumor so it can be examined under the microscope. This involves a small incision and the hole in the skull. Minimally invasive endoscopic surgery. This type of surgery allows your surgeon to remove the tumor or the lesion through your nose and the sinuses. It allows them to assess the parts of your brain without making an incision. The procedure involves the use of an endoscope, which is a telescopic device equipped with a light and a camera so the surgeon can see where they are working. So your doctor can use this for the tumor on the pituitary gland, tumors on the base of the skull, and the tumors growing at the bottom part of the brain. Here we can look at minimally invasive neuroendoscopy. This is similar to the minimally invasive endonasal endoscopic surgery. In this, the neuroendoscopy, this uses the endoscope to remove the brain tumor. Your surgeon may make these small, dim-shaped holes in the skull to assess the parts of your brain during the surgery and the deep brain stimulation. As with the biopsy, this procedure involves making a small hole in the skull, but instead of removing a piece of tissue, your surgeon will insert a small electrode into the deep portion of the brain. The electrode will be connected to the battery at the chest. Like a pacemaker, the electrical signals will be transmitted to help the symptoms of the different disorders such as Parkinson's disease. Here we can look what are all the risks of the brain surgery. All surgical procedure carries some risks. Brain surgery, this is a major medical event. It carries extra risks. Possible risks associated with the brain surgery include people may have the allergic reaction to the anesthesia. They have the bleeding in the brain and a blood clot is formed. They may also have the brain swelling, coma, and impaired speech, vision, coordination of the balance. People used to have the infection in the brain or the own side, and they have the memory problems, seizures, and stress. How to prepare for the brain surgery? Your doctor will give you the complete instructions on how to prepare for the procedure. Tell your doctor about the any medications you are taking, including over-the-counter medicine and the nutritional supplements. You most likely you will have to stop taking the medications in the days before the procedure. Tell your doctor about any prior surgeries or allergies, or if you have been drinking a lot of alcohol. You may be given a special soap to wash your hair better before the surgery. Be sure to pack whatever belongings you may need while you stay at the hospital. Here we can look about the finding a doctor for the brain surgery. Looking for the doctor with the most experience performing the brain surgery. Use the doctor search tool below. So powered by our partner. Immediately after the surgery, you will be closely monitored to ensure everything is working properly. You will be seated in the raised position to prevent swelling in your face and brain. Recovery from the brain surgery depends on the type of procedure is done for you. A typical hospital stay for the brain surgery can last up to a week or more. The length of your hospital stay will depend on how well your body responds to the surgery. You will be on the pain medication during this time. Thank you.